Okay, we're going to talk a little bit about Chapter 8, Nursing Care of the Family During Pregnancy. A lot of the beginning of your Chapter 8 goes over the different aspects of a family. It talks about grandparents adjusting, siblings, father, mother. That's just kind of a quick review. It's not one of those things that you really have to hone in on. There's some more important things in this chapter that I really want to focus in on. One of the things that you guys need to be familiar with as far as terms, and when we talk about pregnant mom or pregnant woman, they are delegated into trimesters. We already talked about a pregnancy is 40 weeks. So trimesters are your first trimester, which is week 1 through 13. Second trimester is week 14 through 26. And third trimester is week 27 through 40. One of the things in this chapter that is very important, and I can almost guarantee that somebody out of your class is going to see Nagel's rule on boards. This is a calculation that you are using to determine the estimated date of birth. In order to do Nagel's rule, you would have the first day of the last menstrual period. You subtract 3 months and then add 7 days plus 1 year. So, and then there's an alternative method of way of calculating Nagel's rule, which is the alternative adding 7 days to the last menstrual period and counting forward 9 months. Most places you will see it's the first day of the last menstrual period, subtract 3 months, add 7 days plus a year. Now we're going to talk a little bit about when the mom goes in, and we've just established that she's pregnant and she's going to start coming in for visits, and there are certain things that are going to be done in order to assess mom and to assess baby. Lab work is going to be done. There is a great chart in your textbook on page 196 that goes over the lab work. And this is important because it is very standard in what each mom gets tested for. Some of the other things that can be done depending on where we're at in the pregnancy is an amniocentesis and ultrasound. We're going to talk more about the amniocentesis a couple chapters down. The other thing you need to know is that once mom reaches 28 weeks gestation, she needs to come in every 2 weeks to be evaluated, her and baby. And then she starts to come in every week after she reaches 36 weeks gestation. She'll come in weekly until birth. Then we talked a little bit about in the beginning chapters a supine hypotension. Some of the things that you need to make sure that you're aware of is because this mom's going to come in and you may be the nurse doing some of the assessment on her before the physician comes in. If you lay her flat to assess her fundal height, which is part of the routine checks when mom comes in, and when I talk about fundal height, what we're actually doing is we're measuring at the symphysis pubis at the top to the top of the fundus. Remember, the fundus is the top of the uterus. The fundus is what you will palpate also in postpartum to determine how mom is doing. And then you just simply take a measuring tape and you're measuring in centimeters the size. The way fundal height goes, it's the same as weeks in gestation. That occurs, I think it is about 18 weeks gestation up until about 36. I'll have to double check my exact numbers. So between 18 weeks and 36 weeks, the gestation height matches the number in weeks gestation. After 36 weeks, baby starts to head down to the descent route and the fundal height becomes a little off. The one thing that you need to know is when you're assessing a fundal height, if you do have a large measurement, it may be multiple gestations. Mom's bladder may be full. 3 centimeters off from the actual week's gestation can indicate a full bladder. So there are some indicators of why the measurement would be large or small, smaller than the week's gestation of mom. Some of the other things that they can do is listen to the baby's heart rate. This can be done in the second trimester with the fetoscope, and then it can also be detected by ultrasound. So we were talking about supine hypotension. When you're checking fundal height, mom is laying flat on her back. She has that risk because we're pushing on the vena cava to become diaphoretic, dizzy, pale, tachycardic, and have nausea. So we want to lay her on her left side so those symptoms can subside because we want to take that pressure off of her. From this slide, it's talking about collaborating care, education, safety. Those are always a big key in any aspect of nursing. One of the things that I want to talk about that could be assessed prior to mom having her baby is assessing breast. When we're talking about assessing breast, a lot of women choose to breastfeed their babies. Well, in order to breastfeed your baby, it's very important on what kind of nipple you have. Some moms may have flat nipples, or they may have an inverted nipple. The nipple should be actually erect because this helps the baby latch on and correctly so we're not hurting mom, and so that baby is stimulating the suck reflex. So this is something that can be also assessed during these frequent visits so that we can set mom up with the teaching and education that she may need in order to help her be successful in breastfeeding if she does have inverted or flat nipples. There are things that we can do to help that. Some other things that come up is alternative therapies. There are different alternative therapies that can be done while mom is pregnant. Remember, there are a lot of things mom is restricted on. She cannot take over-the-counter medicines. There are prescription medicines that she can't really take. There are a lot of medications that are harmful to babies, so mom is very restricted on what she can have when she's pregnant. So this includes herbal supplements too, but alternative therapies is more of your biofeedback, acupuncture, those type things that could be used for mom. Encouraging mom not to drink alcohol, smoke, and even eliminate caffeine. Caffeine can make babies very jittery once they're delivered, because if you're used to drinking, say I drink 2 cups of coffee a day and I do that while I'm pregnant, I deliver my baby's not getting those 2 cups of coffee a day, so they'll have a little bit of withdrawal symptoms from the caffeine because it's a stimulant. Some of the other things that can go on, you guys have a nice little chart in your book on page 198 that talks about complications. Now we're going to talk just briefly, but we will talk about it again, preterm labor. Some of the things you need to educate mom on from the very beginning is signs and symptoms of preterm labor. If she believes she's having lower back pain, pelvic pressure, cramping, and abdominal pain, or feels like she's having contractions, you need to make sure or instruct her to empty her bladder, drink 3 to 4 glasses of water. She needs to kind of lie down almost that she's tilted on her side with some back support. And then she's going to count her contractions. If she is having contractions, they're going to be regular, frequent, and they're going to feel hard. She needs to count them within an hour's time frame. If she has contractions every 10 minutes or more, in an hour, she needs to call a physician or come in straight to labor and delivery because she is probably in preterm labor. And we do not want a mom who is 28 weeks delivering a 28-week baby if we can prevent it. We are going to talk about in class the different birth settings and the different actual care choices of who you can pick and choose to take care of you while you're pregnant. And we'll talk about these in classes, so make sure you review them in your textbook.